All right, here we go. Okay, so today we're going to be talking about the effects of alcohol on the brain. And just to start off with, alcohol, also known as ethyl alcohol, also known as ethanol, and you can see there the chemical formula as well. It is a legal drug. It is a drug. It is produced by fermentation of yeast, sugars, and starches. People often think of drugs as just things that come in bottles, perhaps that you get from the drugstore, or maybe something that you get from, illegally on the street. But alcohol is a drug. Caffeine is also a drug, just for an example there. It can have varying effects on a person based on several factors, including their age, their weight, their overall health, whether or not there is short-term or long-term use. And so before we get into how the alcohol affects the brain, we're going to have a very, very simple, very brief chemistry lesson, because I was a chemistry major. And just want to talk briefly about some of the neurotransmitters of the brain. So the four that we're going to talk about, and these are important, will be important when I talk about exactly how alcohol exerts its effects. Dopamine, which is thought of as the feel-good or the pleasure neurotransmitter. This is one that is released from our brain when we do something that makes us feel good. It's almost like a reward center. So you associate that rush of dopamine with things that feel good. So you want to do more things that will allow you to have additional release of dopamine. Serotonin is another neurotransmitter. It's important for mood stabilization. A lot of the pharmaceutical antidepressants are selective serotonin reuptake inhibitors. So they help to increase the amount of serotonin that's available for your brain to utilize. And then we have GABA, which is an inhibitory substance. So I want you to think of that like the brakes on your car. So, the harder you press on the brake, the faster the car slows down. So think of GABA as like a braking system. And then we have glutamate, which is an excitatory chemical. And think of that like the accelerator of your car. So the more you stimulate glutamate, the faster or the harder you press on that accelerator, the faster you're going to go. So think about those, and we'll talk about how alcohol works. So in the short term, what alcohol does is it activates GABA, which, remember, we said it's like the braking system. So it increases inhibition. So it slows the brain down. It makes it less likely to be able to respond in a rapid fashion to new stimuli. So as a result, your speech is altered, your movements are slowed, your coordination is off, your judgment may be affected. At the same time, alcohol inhibits glutamate, causing decreased excitation. So let's think about that for a minute. We're pressing harder on the brake and we're taking our foot off of the gas, so to speak. So we're slowing that car down. We're slowing our brain down. That's what alcohol does to your brain in the short term. And that slowing down of that brain activity can result in various different things. You can maybe be a little sleepy, a little drowsy. You slow it down too much, you're going to black out. If it's really significant, you're going to have respiratory depression, and you can even die from acute alcohol poisoning. Now let's talk about some long-term effects of alcohol. So in the long term, if you have chronic exposure to alcohol, the brain is going to try to adapt to that. We just said that when you have short-term effects of alcohol, it basically slows everything down. So if you've got this chronic exposure, your brain tries to speed things up to put the brain back in balance. And it does that by decreasing inhibition and increasing excitation. So your brain tries to let off of the brake and press on the gas to try to get everything back in balance. That's if you've had long-term or chronic exposure to alcohol. So now everything's completely out of balance. And this may be the time where people think that they, well, for one thing, they will discover that they need more and more alcohol to achieve the same level of inhibition that they had before. So they need more and more alcohol to make them feel relaxed or giddy or tipsy or whatever phrase you want to use. And that's because the brain is working so hard to put things back in balance. At that point, if you abruptly stop drinking after you've had this chronic use, you're at high risk of going into withdrawal, because now those receptors are used to having that alcohol there and you're taking it away. And as a result, you may experience tremors, seizures, hallucinations, anxiety, agitation, confusion, and the chemical results of that withdrawal are actually toxic to the brain and can result in brain damage. So not only can alcohol damage your brain short term, if you've been chronically exposed to it and you stop without tapering, you can have brain damage in the long term as well. All right, next slide. So how much alcohol is too much? Well, it's a loaded question. But again, let's talk about a few other definitions. So, of course, everyone here, I'm sure, has heard of the phrase, the legal limit. Well, all that means is that's the level above which your blood alcohol concentration, at which point you're subject to legal penalties, whether that's arrest or DUI or losing your license or whatever. So for drivers over the age of 21 in all states of the United States, with the exception of Utah, that legal limit is 0.08% or 80 milligrams per deciliter. It's a concentration. But keep in mind that impairment starts well below this level. So if you haven't had anything to drink, if you haven't had anything to eat and you're a thin person and you don't drink very often, one drink may be enough to slow your response time, to impair your judgment and cause you to be a dangerous driver behind the wheel. So just because you're not above the legal limit does not mean that you are still in possession of all your faculties and safe to drive. That's not what it means. That's just a legal definition for the standpoint of our legal system. Oops, sorry. All right. So again, how much is too much? Well, some other definitions that we need to talk about are what's excessive drinking. Excessive drinking is categorized as several different things: binge drinking, heavy drinking underage, and drinking by pregnant women. Binge drinking, from a definition standpoint, means that you have had enough alcohol to reach that legal limit at one sitting. So that may be anywhere from 4 drinks at one time for a woman. It may be 5 drinks or more for a man. That's just, an estimation. It may be much less for someone who is smaller. It may be much more for someone who is heavier. Alcohol, once you take it into your system, has to be metabolized by the liver, or the liver can only metabolize so much of it. And then the rest of it is circulating out there to affect your brain, to affect other parts of your body. Heavy drinking is considered to be 8 or more drinks per week for a woman and 15 or more drinks per week for a man. So those are some definitions. And of course, anyone under the age of 21, that's considered underage drinking. Now, you may have heard people talk about drinking in moderation. This is another loaded question, another loaded concept. So let's talk about what a drink is. A drink is considered to be 12 ounces of beer, so that's the standard can of beer, 8 ounces of malt liquor. I don't know if people are still drinking malt liquor. I hope not, but if you are, 8 ounces of malt liquor, 5 ounces of wine, which is a pretty short pour. In most restaurants or places, you're going to get, you may get 6 ounces. And then 1.5 ounces of distilled spirits, which is the bartender version of a shot. But people who pour drinks at home typically will put more than 1.5 ounces in a drink. So they may actually be having 2 shots mixed into one drink, or a double. All of those things contain the same amount of alcohol. So, if someone says, well, is it better if I drink beer? Is it better if I drink wine? It doesn't matter. You mix and match these amounts, they're all the same. You can drink 6 beers, or you can have 6 mixed drinks, or you can have, 6 glasses of wine, or whatever. Each one of these things contains the exact same amount of alcohol. So moderation is considered to be 2 drinks or less per day for men, and for women, 1 drink or less per day. However, and note I have this in caps, this assumes that you don't drink every day. So 2 drinks or less per day every day is not drinking in moderation. So you got to keep that in mind and think about these things all in context of what they mean to you and what they mean to your brain and the effects that they're having on you. Oops. Okay. So other considerations. In the past, there have been multiple studies that have indicated that moderate alcohol consumption, again, that's going back to that, 2 drinks a day or 1 drink a day, has protective health benefits. Particularly, we heard this about red wines and cardiovascular disease, also some GI issues as well. But new research is indicating that that may not be true. There have been discoveries now that alcohol increases your risk of cancer. And for some types, drinking as little as 1 drink a day or less can significantly increase that risk, particularly with breast cancer, esophageal cancer. So what we used to think about moderate alcohol consumption being protective, that paradigm is shifting. We don't think that that's true anymore. So less alcohol is really the best way to go. None at all is probably the very best way to go, but limiting the amount that you drink is really important. Okay. So alcohol use disorder is the inability to limit your drinking or continuing to drink despite personal or professional problems. So if you go out to eat and you know that if you order a bottle of wine, you're not going to be able to stop until you drink the whole bottle, or you're already in trouble at work, or you're having problems in your relationships and you're continuing to drink despite that, those are symptoms of an alcohol use disorder. Needing to drink more and more to get the same effects. We talked about that in the earlier slides. If you have now shifted from that short-term effect to you've got this imbalance in your brain where you're having requiring more and more alcohol to get the same effects that you may have gotten when you were not drinking on a chronic basis, symptoms of an alcohol use disorder. And then wanting a drink so badly that you can't think of anything else. Now, I didn't say alcoholism. You can link that in here if you want to too. Alcohol use disorder can lead to alcoholism. Once you get into the issues of alcoholism, you're really at that point, you're talking about a physical and a psychological addiction that you really have to think about the same way you would think about a gambling addiction or a narcotic addiction, or any physiologic addiction. So an alcohol use disorder, if left unchecked, can lead into that. But recognizing that you're having issues or someone that you love is having issues before it gets to that stage really gives you a much better chance of intervening and having a meaningful impact on that person's life or your own life before you hit that so-called rock bottom that we often hear people talk about. If you need help, the first thing I would say do is to contact your personal health care provider. If you don't have one or you don't feel comfortable doing that, I have listed here a 1-800 number for the National Drug and Alcohol Treatment Referral Routing Service. And they can, put you in touch with resources that are available to you in your area where you live. So I think that's it for my slides, but I think I skipped one. Here we go. Don't drink. You should not drink at all if you are pregnant or breastfeeding. That should go without saying. There is some thought that, or there has been some discussion about, it's okay to drink if you space the timing between when you breastfeed, express the milk and discard it before you nurse the baby. But really the best thing to do is not drink if you're breastfeeding, and definitely not if you're pregnant, because it can have very significant effects on the fetus as it's developing. Of course, if you're under the age of 21, you should not drink for a lot of different reasons. One of which is it's illegal, but then the other of which is, as we heard the gentleman say, that prefrontal cortex isn't fully developed until you're 25. So why would you want to be subjecting your brain to, the risks of poison? I mean, alcohol is a poison. It's a drug. It's a neurotoxin. Why would you want to run that risk of causing damage to a developing brain? There are certain medical conditions and certain medications that can interact very negatively with alcohol. Of course, if you are recovering from an alcohol use disorder, as we mentioned before, you should abstain from alcohol. We already said that one of the symptoms of that is not being able to have very good control over how much you drink. So if you have been successful in abstaining, then I would encourage you not to think, oh, I can have just one drink, because you may not be able to have just one drink. And then you may start on that roller coaster again. And then obviously, if you're having trouble controlling or unable to control how much you drink. Other things that I didn't talk about as far as effects of alcohol in the nervous system, As I said, it is a poison. It's a neurotoxin. It means it's toxic to the neurons in the nervous system. It can cause neuropathy. You can have significant impairment in the sensation and the use of your arms and legs. It can cause you can have cerebellar degeneration from alcohol, meaning that the alcohol itself actually damages or destroys parts of the brain, in particular the cerebellum, which is your balance center in the back of your brain, is particularly sensitive to alcohol. And a lot of times you can look at a brain and you can get some indication or a suspicion of whether or not someone is a chronic user of alcohol by the way certain parts of their brains look, because of the actual direct effect the drug is having on them. Of course, as we talked about, you can also develop some pretty significant nutritional deficiencies. People who are very heavy drinkers don't tend to eat healthy. I know that's one of the main focuses of this group, is about eating healthy. And you can get some very serious nutritional deficiencies, in particular thiamine deficiency from chronic alcohol use, which if you have a severe thiamine deficiency, that can have some very negative effects on your brain. It can lead to confusion. It can lead to problems with your vision. It can cause psychosis. And if it's not recognized and treated appropriately and very rapidly, you can actually develop a permanent, almost a permanent dementia-like state that's strictly caused by nutritional deficiency that's a direct result of alcohol use. And then we didn't even go into things like, bleeding ulcers and cirrhosis of the liver and all these other things. But as I said before, alcohol I won't say that it has any significant beneficial health benefits, but it certainly has very significant, it can be very detrimental to your health, and you need to be aware of that, particularly if you have family history of people who have had difficulty controlling their alcohol use, or if you have family history of certain conditions that would make you very susceptible to alcohol, history of liver disorders, that may not even be alcohol related, or medications that affect the liver, then you wouldn't want to, pour gasoline on top of that fire by mixing that in with them as well. So I'm going to stop here. I'm happy to take any questions if anybody has any. I'm going to stop sharing my screen now.
Okay.
You can all look at my smiling face.
That is excellent. So please put your questions in the chat, and we will. I know while we're waiting to read the chat, Dr. Angela, what about there's a lot of Alzheimer's occurring now, particularly in age groups 50 and over, and any studies with correlation with dementia, Alzheimer's, and all that sort of thing with alcohol consumption?
So yeah, you can. So dementia is an umbrella term for a neurodegenerative condition of the brain. And underneath that umbrella, there are several types of dementia. Alzheimer's is one type. There's frontotemporal, there's vascular, there's, all different types. You can develop a dementia that is directly related to chronic alcohol use. As I mentioned before, that has to do with the effects that alcohol has on the brain. The parts of the brain that are damaged as a result typically tends to be the cerebellum. You can also see damage to the thalamus and some other parts of the frontal lobe. One of the other things that happen in people who are chronic users or abusers of alcohol is because of those impairments of their motor skills, they tend to fall a lot. And so they tend to get a lot of seemingly mild head injuries, but over time, those things can add up. You can get subdurals, you can get other types of bleeds, contusions, multiple concussions. And as a result, you can also develop brain damage from that, which is a secondary effect of the alcohol, not necessarily the alcohol causing the direct damage, but the alcohol leading to the falls that subsequently lead to the damage. As far as alcohol and Alzheimer's, off the top of my head, I'm not necessarily aware off the top of my head of any direct correlation between those two things. But certainly, there's a possibility. Alzheimer's is a multifactorial, disorder. We're learning more and more about it and more about the causes. And as you get older, our bodies and our brains in particular are not as flexible or as plastic as they used to be. So we don't bounce back from things like we used to. Our exposures to things can leave us with more residual findings. So heavy alcohol use, the older you get, can actually, because you don't have as much of a reserve as you had when you're younger, can cause significantly more problems for you than it may have when you were younger. And then again, that in turn can start this whole cycle that can then lead to some other secondary problems.
And by that reserve, I often use the term, as we get older, the body gets less forgiving.
Yes.
I'm assuming that's what you're talking about.
Yes.
We can't get away with partying all night and going to class the next morning.
Yes.
When we get older, we have to make lots of adjustments because the body just cannot respond as it has when we were in our youth.
Yes. Someone in the chat mentioned the Wernicke-Korsakoff syndrome. That's what I was talking about by the thiamine deficiency that you can get as a result. That severe thiamine deficiency is what leads to the Wernicke-Korsakoff syndrome. I didn't use the term, but that is the term. Yes, that is the correct name for the syndrome that I didn't give a name to.
Okay, would you go over that again, Dr. Angela?
Yes. So so when I was talking previously, I was talking about how people who chronic alcohol use can lead to nutritional deficiencies. One of those nutritional deficiencies is thiamine. Thiamine deficiency, if unrecognized and untreated, can lead to what's called Wernicke syndrome. You get abnormal eye movements, you get confusion, you can have seizures, you can have psychosis, you can have lots of problems, weakness, you can lose your ability to walk, so on and so forth. If you recognize that that's what's going on and you treat that person with thiamine, over time, they can regain everything that they've lost and return to their baseline. However, if it is unrecognized and that continues to go on untreated, that Wernicke syndrome goes from something that's reversible, it turns into a type of dementia called a Korsakoff syndrome that is not reversible. And all of that can be related to this thiamine deficiency that can be a result of chronic alcohol use and poor nutrition as a result. And it can be very devastating. I've seen it in patients, I've seen it in family members, and it can be very dramatic. Another place that it's seen is in people who have had gastric bypass surgeries and they don't take their vitamins that have been prescribed for them. Because when you have those surgeries, you're unable to absorb as much of your nutrients from your food as you were previously. So you have to supplement. And if you don't, they can also develop a thiamine deficiency and they can get that same syndrome as well.
What are some of the foods that we could eat that possibly could provide a high source of thiamine?
Oh, well, I mean, I think the key I don't think that there's necessarily foods that, I'm sure there are foods that are higher than thiamine than others, but the key to everything always when it comes to nutrition is balance. You want a balanced diet. You want lots of fruits and vegetables. You want to, limit your fat. And you want to try to eat the rainbow is what I call it, where you're eating, foods of all these different colors, because they all contain different types of antioxidants and different chemicals that are used for phosphorylation and so forth. And so it's better for your body. So you don't want to just, you don't want everything you eat to be white. You don't want everything you eat to be green. You need some red, you need some blue, you need some yellow. So you want to eat the rainbow. I know there's a lot of focus here on plant-based diet, but that doesn't mean that meat is a no-no for some people. It's not. But again, you want to stick with leaner cuts of meat. You want to avoid frying. You want to, broil, try not to use so much butter, just healthier. Just, it needs to be it's not necessarily a particular diet. It needs to be a mindset about healthier eating. Just because a lot of us grew up in the South and the way that we ate and were taught to eat and what we had access to eat is not necessarily the best for us. And when you know better, you should do better. So hopefully at this point in our lives and with the exposure that we have to different resources, that we are open and accepting to some alternative ways of cooking and eating that are healthier for us than perhaps what we grew up with when we were children. or
Absolutely.
younger adults.
Yes, well said, beautifully said.